But I do want to thank you, Kalee. You gave me the idea for this first segment, actually.
Oh.
And so this segment actually is one that came from when we were talking about the gender surgery in kids, and you were asking, I think you mentioned something about, well, what about breast reduction?
Yeah.
And I was like, oh, that would make a great segment.
Yeah.
And so this is a segment on teen or kid plastic surgery, what's okay and what's not. And that's certainly up for debate, and we are going to debate it because I want to see what you guys think.
Yeah.
I feel like I'm pretty conservative when it comes to this stuff. Like, I'm not overly aggressive at all trying to do surgery on people that probably shouldn't have it. But you guys may be more conservative than I am. So anyway, this past week on social media, the whole thing about the gender stuff in kids has been on social media. I don't know if you guys get a lot of medical, your feed is what you watch, right?
Mm-hmm.
So my feed on social is a lot of, it's news and it's like medical topics. And so, the whole past 2 weeks, it's all been about the gender surgery stuff. And so someone made the argument that, well, if we're going to limit doing the gender surgery kids, then they shouldn't have plastic surgery at all. And a lot of people are like, yeah, that actually sounds fine to me, and I think on the face, I think when it's presented like, should kids have cosmetic surgery, I think most people would say no, right? I mean,
yeah.
I think that that's a very safe thing to say. But, they were saying that we should potentially ban this. And then that's where I was like, well, as much as I, might be against what the spirit of that is, I would be a little nervous about banning it because there are certain surgeries, I think, that are very good that fall in that gray area of, is this reconstruction or is it cosmetic? And so I kind of want to break down like what surgeries kids are having, like what, would be, everyone might agree is, not good, and what other people would say for sure, and then what about the ones in the middle? Mm-hmm. All right, so you guys can break this down with me. Ready?
Yep, ready.
All right. So, my big concern is about what is the gray area. But let's talk about the edges first. And I'm going to talk first about kind of in classes of surgery. So, all right, so for example, if a child has a congenital malformation, let's say cleft lip, cleft palate, cranial deformation, I think that no one would come out and say that they shouldn't have plastic surgery, right?
Absolutely
I mean, that's
not.
obvious,
Yeah.
right? I mean,
yep.
and to be fair, when most of the people were saying this, they were saying specifically cosmetic. But there's tons of surgeries that are done for congenital malformations on kids every single day, kids and teens as well. And that's the cleft surgeries, the cranial surgeries. Ear remodeling is another one,
yeah.
which, I mean, honestly, that to me is not as much reconstructive as it is aesthetic or cosmetic. Like, that's another one I think could be caught up in the cosmetic, bucket if such a ban. I'm always afraid of bans, right? Because
why do we have to ban?
Right,
why does
yeah,
it
why do we
have to be a hard out? That's one of the biggest things that bothers me is when we've got to say, okay, no one can do this. Period.
Yeah.
There are always exceptions to the rule.
I'm personally against bans myself, almost to a fault. It's like, I mean, I think that people should make their decision. With kids, I'm maybe a little less hard line on that because when decisions are made for for example, classic. I'm not a big believer in seatbelt laws because I mean I feel like if you want to not wear a seatbelt and go kill yourself, then that's your option. I'm against helmet laws, but do I wear a seatbelt? Do I always wear armor and a helmet when I ride my motorcycles? Yeah, every single time.
Yeah.
But I'm just kind of against coercion laws. But again, with kids, they're not necessarily able to make that decision for themselves.
Yeah.
So. And I kind of got off on a tangent there, sorry. But then there's the opposite end of the spectrum on these surgeries is stuff that would be considered pure cosmetic. And I was trying to think, okay, what would be the most purely cosmetic surgery? Brazilian butt lift. Purely cosmetic.
Yeah.
I don't think anyone in the world, well, I don't know, maybe there is people, but I think that should absolutely not be done on kids. There's no excuse to do a surgery like that. Now, I don't like the surgeries on adults.
I was going to say, I know you, and you definitely don't like that
and
on
I sure
adults,
don't like them on kids. In fact, we did a segment, it was about, I don't know if you may have been here, Brendan. Were you here when we did the segment on the girl in Mexico where the mom took her to get a breast aug?
Yes,
and a
I
Brazilian
do
butt lift,
remember that.
and she died. And,
I
and then
think
she
I
tried.
was actually.
You maybe have heard. Maybe we
She
talked.
tuned in.
You tuned in.
I tuned
You
in.
just saw it. Yeah, nice.
I tuned in. I was there.
Well, I mean, it's really tragic, actually. The girl died from the surgery, and then there was a
Awful.
cover-up.
Mm-hmm.
They tried to cover it up
my
to the
goodness.
dad. I guess the parents were estranged or whatever. So obviously, Brazilian butt lift. I mean, I just can't imagine that there is anyone out there who would say, "Oh yeah, I think that's fine to do with kids." Liposuction would be another one. I was trying to think if there was any. instance of liposuction where I'd be, that's okay. The only thing I could think of would be, again, a congenital malformation where somebody had like some really weird lipodystrophy that they were getting bullied for. I mean, maybe, but like your classic, like, I want to like slim down liposuction on kids. No way.
Yeah.
I can't.
Well, your body's not developed.
Right, yeah, exactly, true. Yeah, and then that does get into these gray areas. So now I want to talk about the gray areas, which are things that may not be a severe congenital malformation and may not even be considered functional, but the appearance might cause them emotional distress.
Yeah.
And that's where I think that, a potential ban of plastic surgery on kids could really end up hurting, some people. And granted, these are not tons of shit. So I'm going to go through individual procedures. And the first one is the one you mentioned, breast reduction. All right, what do you guys think? Should someone, and when I say kids, I'm talking like 13 to 17, right? I don't, when I say teens, I'm not talking to 18 or 19-year-old. Obviously, they can do what they want. They're adults. But, I mean, what are your thoughts on breast reduction? And if you think different than me, that's fine. I mean, what are your thoughts on breast reduction?
How much time do we have?
As much as you want.
Well, I obviously have a lot to say because I did this, right?
As a teen?
I was 18.
Oh, I didn't know that.
Yeah.
Oh, okay.
So, I mean, I wanted it before that. So, when you're,
I had no idea. I did not come up with this segment expecting you to like tell your testimony, but and obviously don't tell more than you want.
Oh, I don't mind. As Jeff, he can just come in. I just tell everyone everything. So that's kind of
okay.
How it
So
is.
you wanted it younger.
Yeah, I wanted it younger. So I'm 4'10". For those of you who are watching, I'm very small. I had double Ks. When it was all said and done and the surgeon came out and said, do you want to know how large she was? I was double Ks. Yeah. So when you think about that on a, I think...
Like functionally, it's hard to do stuff.
Right. I think back to, I was in 5th grade. I went on vacation with my aunt and my grandma, and I had larger breasts than my aunt did, right? At that age. Yeah. And then it just kept getting, and I was a performer, so I sang and danced in shows and everything, and I had to duct tape because there was a whole bunch of outfits that you couldn't wear a bra for. Yeah. So I would have to duct tape to...
But your whole life has changed because your breasts are exposed. Yeah. No, I mean, I get it.
So I would bleed. I would, when we rip it off, I would have to go get... I could go, I don't mind. But, so for me, it was like, hey, this is impacting my life. Like indentations Grooving, in my shoulders, my back, it was just a lot. So for me, I knew... It was funny because I think I brought this up on that episode, but my surgeon refused to do it until I went through a whole bunch of hoops where I had to go talk to a psychologist about it. I had to go to a chiropractor. I had to do all of these things. I had to do a 6-month workout where they were trying to see if I could lose it on my own.
Do you know if they were doing that because of an insurance requirement, or was that like the psychological requirement?
It was both. So they were also trying to get the insurance, but he also said, okay, first things, he was like, you are not developed yet completely. Yeah. You also may not be able to breastfeed, so you're not thinking about the things that one day you're gonna wanna do or that may impact it. So he just wanted me to know, but what's funny is I did a school presentation in my speech class on a breast augmentation or breast reduction. Yeah. And so I knew everything. So when I talked to him, he was like, okay, you know a lot more than the average teen because you're obviously very passionate about wanting to do this.
It affects you,
So I sold it, but it's a 6-hour surgery for me. I was under for 6 hours. I had over 750 stitches.
That's huge.
It was a huge, thing to do, and I understand that now, but...
Did they tell you how much weight they took off?
Yes, it was 3.5 pounds each, so about 7.
3.5 pounds. I'm trying to think in kilos. So, okay. The biggest one I ever done was 3.5 kilos per side, the 3,500 grams. So that was 8 pounds per side, but that's like a one-off.
I don't think mine were definitely not.
So I'll weigh in on this. I think that the way that your surgeon went about it was way conservative, in my opinion. And other people might disagree with me, but the way I just anticipate you're going to be like, yeah, I agree with you when I say this, but at the point that your life is affected to that degree, to me, it doesn't matter if you're, 13, 14, 15, or 16, you talk about what the potential, after effects of this are. I mean, they're right to talk about breastfeeding, but in reality, that risk is very low. And that does depend a little bit on technique. At least the way I do it, that risk of it being affected is very, very low. You mentioned about, are you done developing? I mean, to me, that's like one of the bigger ones. It's like, if you do it too early and they're still developing and their breasts are still growing, then you may hit that target they want, but then a year later they're too big.
Well, that's
again.
what happened to me.
Oh, so you did continue?
I did continue to grow.
Okay.
Yeah.
See, and I would say that that's not necessarily typical. I mean, a lot of girls, they get to the size they're going to be fairly early. So, I mean, I've actually done a few breast reductions on under 18. And that's one of the things I always ask, like, are they still growing? And
how do you know though? As like me, like.
I mean, I think most people. I feel like most people know, or maybe like at least they're plateaued.
Yeah.
I mean, if you gain a quarter of a cup size after a reduction, well, okay, that's not a huge deal. I mean, but you don't want to do it super early and then they gain like 2 cup sizes.
Yeah.
And I haven't had that happen personally, and I honestly don't know the youngest I've ever done. I don't think it was 13. I mean, it was probably like 15 maybe.
Yeah.
And that was, to me, the biggest question is like, okay, where are we in the growth? Are they done growing? Are they not growing? Because you don't have to do it twice.
Yeah.
But then again, like if a kid like can't even like go to school because they're so large, I mean, you could almost make the case to do it whenever.
Well,
I mean,
and that's my thing is like, if it's impacting your life, like
to that degree,
it's only going to be kind of positive.
Right. It's one thing if they say, look, well, my breasts are so large, I can't, be a sprinter on the track team. Okay, well, I mean, that's kind of a bummer. But like at the point where they're like, I can't even do any sports at all.
Yeah.
I can't wear clothes. I mean, at that point, I think it's a no-brainer to do it. But it does require a lot of discussion. Discussion with the patient, discussion with the parents. But I've never had any type of issue. I mean, all the ones I've done, and it's not a ton. Like, I mean, it's a handful. Everybody was completely psyched. They were like, "This is the greatest thing ever."
Yeah.
I think that
so amped. My mom was like, "Please do not go to school and show people your boobs." Like, immediately, she just knew. Like, I was so excited that.
Well, that's interesting. Yeah. I don't know. I think that your surgeon was definitely a little conservative. I think probably more surgeons be like me, like, okay, let's like look at this very, analytically and systematically to decide, okay, when's the best time to do this?
Yeah.
But just because someone is, not 18 yet, I think breast reduction is definitely on the table, personally.
Yeah.
All right. What about breast augmentation? I'll let you guys answer. Like, so breast augmentation, like getting a breast implant. Brenda, you got to answer first.
Okay. So I agree with like the last thing with everyone, because I have a friend that I can't remember what size, but it was like G or H or K. I don't know.
It's a letter that's down the alphabet.
Exactly.
It's not towards the front, it's towards the middle.
Yeah, and she still wants to get, she's my age, she's 23, and she still wants to get reduction. Sorry, I couldn't remember the word.
And she wants another
No, she wants one. She hasn't gotten it yet. But anyway, the implants though, I feel like you should wait, because like I have a friend that got her high school graduation present from her family was her like breast implants.
You hear about that all the time. I've never had that happen.
And I was like, of all the things, she was like, no, I want this. Like, this is where the money is going to go. Yeah, it's just like, but she waited till she was 18.
Okay, that's smart.
In my opinion, I feel like you should wait till like, I don't know, because I mean, me, like I considered it when I was younger, but then I was like, oh, maybe they'll come in. Never did, but now I'm like, whatever. So.
You're just like used to it, yeah.
maybe they'll come in.
Yeah, maybe my 20s. Nope.
I mean, so I would say for purely cosmetic, I would not do an augmentation on someone at 18. Yeah. In my opinion, when you hit 18, you're an adult, you can do what you want. But until you hit that age, like, I just think, to me, I would not do a purely cosmetic augmentation on a 17-year-old. There's no way. No way would I do that.
Yeah.
Now, that being said, what I have done is you will see from time to time, and I've done a couple or 3 of these, you will see amastia, unilateral amastia, which is basically where one breast develops and the other does not. And
interesting.
Yeah, I've seen it a few times, and I have done augmentations for that, but single side. Right, and to me, like, that's not cosmetic. Like, that's reconstructive. That's a congenital deformity, and using an implant can change that kid's life, because you can imagine if you have like a D cup and an A cup, like that's a hard road to have to walk down. So All right, what about nose jobs on a sub 18-year-old? So say a 16-year-old wants to get a nose job.
I honestly wanted one, but it was like my biggest insecurity was on the side. But now I'm like, my friends have told me that
Really?
my face, yeah.
I think your nose looks
I don't
nice.
know. Thanks.
you have
It's
a
from
cute nose.
it's
You
the
have a
side.
great
What?
nose.
Thank you.
She's like, I needed that today.
I have a bad nose. Look at this thing, man. This thing's like
No, look- yeah,
this
me
is like
too.
an
It's my-
eagle talent. Or
Yeah, I got-
My
eagle
dad's
hook.
side of the
Mine is
family.
Yeah.
We all have like the
I got
same.
that German nose, man. It's just like, here it is.
Yeah, I don't know. I always wanted one, but I would definitely wait
I'm gonna be honest.
like till older.
I would like to say that I think it's okay. On that edge.
Listen,
Yeah.
The only thing that I will say is that I've had, a breast reduction surgery, and I also had a deviated septum. I didn't get a full nose job because obviously we still have some issues need to be worked out. But I still had the deviated septum surgery, and it was harder on me than the
nose.
breast reduction
Oh,
surgery.
yeah, totally.
So when
Yes.
when I look at it like
That's
that,
an intense surgery.
That's
Yeah.
where I go,
Yeah.
ooh, that's gonna be tough for them. But at the same time, the nose for me doesn't really bother me for some reason. Like a kid getting
I
a
kind
nose
of
job.
agree.
Yeah.
I don't
Because
know
I have
why.
one. I have a deviated septum too.
Yeah,
for
well,
sure.
I mean, and I think obviously if it's a functional issue where you can't breathe, then at that point, obviously anyone can get surgery at any
Yeah.
age, right? And I think that should be noted. Okay, functionally, if it's not working, yeah, of course a kid can get a nose job.
Yeah.
I was thinking more like aesthetically. So here's my opinion: is that I think that in certain circumstances it could be totally reasonable. And so what I would think of in that situation is a kid that for whatever reason has a nose that is so unusual that it starts to become a issue of bullying and mental health. Because it's not that they're trying to take a normal nose and make it more perfect. It's that there's obviously the aesthetics or the shape of the nose is so far away from the norm that it draws like a lot of unwanted attention. And so I could get behind that,
Yeah.
because that would be considered a cosmetic surgery. It's not
Yeah.
functional, but is it though? Is it not functional if it improves mental health?
I agree.
I mean,
I totally agree with you, honestly.
There's
do.
a lot of research to back that up. Now, the research is in adults, but I mean, okay, fine, it's not specifically on kids, but like the same rules to me apply. If somebody has something that everyone, 9 out of 10 people in a room would agree that this is like way off from norm, and you could understand how it could be an issue of, isolation and bullying, which is, bad for mental health. Like, I personally wouldn't have a problem with that. Especially because it's on your face, right? If someone you might say, okay, well, what if someone has really small boobs? Well, I mean, they're not out in the open,
No,
right?
yeah.
I mean that, and plus a lot of people have really small boobs. You know what I
Yeah.
mean? So I don't know. On the nose jobs, I'm kind of like, yeah. I mean, if it's bad enough that like their mental health is suffering, like truly, and it's not like a body dysmorphic issue where you would look at it and be like, your nose looks fine.
Yeah.
Right. I think that'd be okay. All right, breast lift. I'm gonna say I'll just go first. I would say no on a breast lift. I mean, I know I do tons of breast lift. Patients absolutely love them, but again, this is something that kids shouldn't be worried about because no one's going to see it.
Yeah.
You know what I mean?
I agree.
And if they want to get it when they're 18, fine. But I mean, to me, like doing it unnecessary surgery with no clear benefits on a kid is just out of bounds for me.
Yeah.
Yeah.
I agree with you on that.
Liposuction, I said no. I mean,
Yeah, no
I think that
thanks.
again,
Yeah.
that's a purely aesthetic thing. I mean, I was trying to in my mind think of like, oh, what if, I don't know, somebody had like some sort of weird genetic fat lipodystrophy. Well, okay, maybe, but it'd have to be something really weird. All right, Brazilian butt lift we already covered. Absolutely no for me. That's a hard no. Gynecomastia on a male. So gynecomastia is man boobs.
Yep. We talked about that.
Gynecomastia on a 15-year-old or 16-year-old. What do you think? There's no right or wrong answer here. Don't stress about it.
I know this is tough.
This is tough because it's kind of like, is it a,
Do you want me to go first?
yeah, mental health issue, right?
I've done
image.
I've done gynecomastia surgery on an under 18.
Yeah, I mean, I don't know. I don't see the problem.
Well, you know
with
why?
it.
Because if they're in sports, they have to have their shirts off.
Yeah.
Right? In
Yeah.
fact, I remember when I was in high school, there was a kid at my high school, and I can remember clear as day, like he had the most feminine looking breasts I'd ever seen.
Yeah.
Like it was, and everyone like totally, I mean, I was not that kid, but like a lot of kids would just like give him the worst
Oh,
grief
it makes my heart hurt.
ever.
Yeah.
Now he was a big kid, so I mean, you had to be really careful what you said to him. But I mean, it's that, even though it's like something that's generally covered up, like if a kid's in sports and and it truly looks like a female breast, I mean that could totally just I lived it not as the kid, but watching other kids pick on another kid for it. So I don't remember how long ago it was, but I think I've done one where it was a under 18 male that had gynecomastia and we fixed it, and it went great. Like so.
I feel like that's similar to the breast reduction.
I do too. Yeah. Well, I think it's less functional and more psychological mental health. Yeah. But I just think in summary that common sense, right? I mean, I think this is just common sense. Like, you should not do a purely aesthetic surgery on a kid. That's just my opinion. I mean, some people may disagree with me. But on the other hand, I think banning this is a bad idea because I think that there are some gray areas, like we talked about, that might get caught up in a ban that really are very beneficial to a kid. So.